Well, they weren't really. It's a gradual process. You could answer they were first provided with the National Health and what have you, 1950s. But there again, the first asylum opened in 1823 as part of prison reform, really, with Sir George Paul, who set up the model prison in Gloucester and around the world. As a part of that, he had to remove criminal lunatics and others that were within the jail system. He'd been to Europe on tour as a younger man. He'd seen the Tower of Fools, which was a purpose-built tower in Vienna for the mentally ill. And so he would put those together. It was a fairly early experiment, actually, because eventually, although he died before before Horton Road, the asylum opened in, say, 1823, died about 2 years before then, it was still the 11th to be built in the entire country. But then you see, in answer to your question, you had Bedlam in London that had been going since 1200 and something. So you asked me, when did it start? Did it start with Samuel Hitch, who came along 8 years later in 1828, young fella, he was only 28 himself, and very active, open doors, allowing patients to go into Gloucester on their own for church on Sunday, 14 of them in a cottage with the gardener, not locked up, many advanced bits there. But there again, they were for first-class patients, not the ordinary pauper lunatics, which were still chained up in the cells underneath the driveway of Horton Road. He did go to Hanwell to see John Connor, a very famous chappie, who had opened all the doors and got rid of the mechanical restraints, and he introduced those about 1850 into Gloucester, an advancement. But there weren't all that many people happy with it. The people who sent patients to the lunatic asylum were magistrates. There were two public hospitals. There was the First County Asylum, which later became Wootton Asylum, which then in 1930 was renamed as Horton Road Mental Hospital. The second one to be built to replace it, but it never did, was Coney Hill, which was the Second County Asylum, all the way out in the countryside in Barnwood. So that was the two. But also there was a private hospital, which our own poet was in, Ivor Gurney, who wrote the only poem he ever wrote whilst he was there. That was in Barnwood House, about 1850 odd. And the poem was called To God, and it was quite sad. It's really saying to God as a prayer, why have you sent me here to be incarcerated, etc. So it's a fascinating poem. So that was the three, but you must remember too, there was a proliferation of private asylums in the county. And we mentioned Samuel Hitch as one, the superintendent. He eventually left in 1850 for his own private asylum. There was money to be made. It was described in the London Morning paper as the worst hospital in the country. Yeah. But, as I say, it swings and roundabout. You have that, and then along come other people. Dr. Craddock, who was a eugenist. He was advocating nationally that all women that had been a patient in a mental hospital should have permission to marry and have children. They shouldn't be automatically there, and that permission shouldn't be given to severe cases because they were going to reproduce more mentally ill people. So you have those arguments right through to 1956 when Dr. Mandelbrot came. And the 1950s, probably the answer to your question, because in the 1950s we saw the introduction of some of the key medications still used today. We have Largactil, chlorpromazine as a tranquilizer. We had stelazine came out, which was for the treatment of delusional thoughts, etc., with schizophrenia. We had the first antidepressants came out as well in that year. And we had the enlightened people. We had the sociologists, Goffman's asylums, how they've been destroyed, we shouldn't have them. And you've got Enoch Powell, would you believe? Not in the good favour in the public eye recently, but as Minister of Health, who said, I'm the Minister of Health, not the Minister of Agriculture. And he predicted and made sure that the big hospitals like Coney Hill lost their farms. We had 324 acres, I think it was, off the top of my head, at Coney Hill, so a lot of farm area for patients to work in. So it was the start of the decline. Dr. Mandelbrot mixed the wards, got rid of the locked wards too. He introduced occupational therapy. He sent 2 ladies, staff, up to London to become beauticians to come back to the hospital. I'd also say during this period, just as memory recalls, the artisan staff, now we talk about the carpenters, plumbers, even the undertaker attendant, who were attendants not trained up to this period really, they had a patient working with them, so that you had lifelong friendships develop between